The top 3 causes of erectile dysfunction are diabetes, cardiovascular disease, and different medications. Now, there are other causes. If you've had pelvic surgery or pelvic radiation, that can contribute. But the majority of patients who suffer from ED tend to be over the age of 50 with either diabetes, cardiovascular disease like high blood pressure, as well as certain medications that make it more prominent. So low T in and of itself, or low testosterone, does not discretely cause erectile dysfunction, but it can contribute to it. Testosterone, I tell patients, it's like the fuel for your body. Especially for a male's body. It helps with energy. It helps with sex drive or libido, with weight gain and weight loss. It also helps with erections. So if your testosterone is low, it doesn't mean that you won't be able to get an erection at all, but it may be compromised. And by correcting the testosterone, it can help with the quality of your erections. So currently, there are 5 different FDA-approved treatment options. One is tablets. So that's Viagra, Cialis, Levitra, Stendra. Those tablets don't get you erect on their own, but they make it more likely for you to get an erection. And usually you have to take it at least 30 minutes to an hour before any sexual activity. The second is a vacuum erection device, which is a vacuum pump that you place over the penis to create a suction and pull blood into the penis to get it firm, and then use a constriction band to kind of trap that blood flow there. There's also urethral suppositories, or what we call MUs. These are like little rice grains that you insert into the urethra, and that allows for blood to rush to the penis for it to get firm. There are injections that you can give yourself in the side of the penis. And every time I say that, I usually get stopped and said, "You want me to do what?" But these medicines don't hurt as much as you might think. The injections, you give yourself typically about 10 to 15 minutes before you plan on being intimate. And then there's also surgery with a penile implant, which is a device that's completely inside the body. So if you were naked, no one knows you have anything in. And it's the only device that allows you to have a more natural erection outside of medications. So Shockwave right now is investigational, meaning it is not FDA approved to treat erectile dysfunction. I believe in years to come, we probably will have it as something that we can use to treat ED, but for now, it's only used for investigational purposes. If you have a problem with your car, you take it to a mechanic. You don't take it to the local grocery store. If you're having a problem with your erections, you want to take it to someone who focuses on treating erectile dysfunction, and that's a urologist. There are plenty of men's health clinics around the city and the country, and for majority of those clinics, it's not staffed by a urologist. There's not a physician who focuses on treating ED there. So you want to be treated by someone who is a certified urologist and specializes in this field to get the best treatment options and outcomes. There are 2 basic different implants. One is an inflatable and one is a semi-rigid, or what we call a malleable penile prosthetic. The inflatable implant is composed of 3 parts, and it allows you to keep the penis soft or deflated when you're not using it, and rigid or inflated when you are using it for intimacy. The semi-rigid is semi-rigid all the time. And so when you are not using the penis for intimacy, you simply bend it down. And when you're using it, you would bend it up into the erect position. So the nice thing about the penile implant is it's inflatable. So you can deflate the device and no one can tell you have anything in. I always tell my patients, if you were naked at the gym, no one would know that anything's there. So it is very discreet. So a lot of times patients will say, "Oh, is this something it's experimental?" But it's not. There are a lot of patients walking around with the device and you just don't know it. As with any surgeries, there's always risk. Risk of pain, but we give you several different pain medicines to help. Risk of bleeding where you need a blood transfusion, less than 1%. Risk for infection is about 1 to 3%, and it's higher if you're diabetic. Risk of device malfunction is 100%. It is a mechanical device. Over time, it will wear out. And when it does, you'll have to get it replaced if you're still being intimate, but it usually lasts anywhere from 10 to 15 years. And then risk of injury to the penis, the urethra, the scrotum, the testicles, the bladder, less than 5%.